if you want to avoid all the sickness this winter, the snotty noses, the coughs, the colds, the sleepless nights, the fevers, the Panadol and the antibiotics, the ear infections, the grumpy, tired kids, the days off work and school and childcare, are all those memories of last winter coming back? I'm here to tell you that it doesn't have to be that way this winter. I have a free online masterclass, 3 simple ways to boost your kids' immunity to avoid a winter full of sickness. It's on demand, meaning you can register and watch it straight away or watch it at a time that is convenient for you. Head on over to naturalsuperkids.com/immune and you will be able to sign up. In the masterclass, I am covering our natural, simple and effective approach to avoiding winter infections, how to boost your family's immunity with our proven 3-step naturopathic strategy that is really easy for you to implement as a busy mum. We're going to talk about the immune depleters that you need to avoid so you're not wasting time and money building up your kids' immunity that is just being depleted by these common foods and environmental factors. I am sharing heaps of practical tips. I promise it will be an hour well spent. You can register again at naturalsuperkids.com/immune. I can't wait to hear how you find it and to give you the tips to make this winter healthier. Welcome to the Natural Super Kids podcast, where you will discover practical strategies to inspire you to boost the health and nutrition of your kids. I'm Jessica Donovan, a qualified naturopath specialising in kids' health, and I want to make it as easy as possible for you to raise healthy and happy kids. Let's get into it. Hello, everybody. Welcome back to the Natural Super Kids podcast. Gosh, I am excited and honoured to introduce you to our amazing guest today on the podcast, Dr. Leila Masson, who's an integrative paediatrician. So we'll get to our conversation in a moment. What we're focusing on today is a condition called PANS, and sometimes also known as PANDAS. So PANS stands for Paediatric Acute-Onset Neuropsychiatric Disorder. As the name suggests, it's complex. There is, a lot to cover. But what I love about Dr. Leila and her work in general is that she's got this really she's got a really good knack, is all I can say, of breaking down really complex health conditions and complex, scientific information into bite-sized, easy to digest, easy to understand pieces for both practitioners and patients. So she's quite well known in the naturopathic world, the integrative medicine world, because she does present to a lot of practitioners on different topics like PANS. And I listened to one of her practitioner trainings on PANS, and I got in touch with her and I was like, would you like to come on the podcast? You've got such a good way of sort of explaining this, and obviously a lot of knowledge in this area as well. So I will let her explain more about PANS, but just to give you a bit more information about Dr. Leila Masson, she did her pediatric training at the University of California in San Francisco. She has a master in public health from Harvard University. She treats children with autism, ADHD, PANS, which is what we're focusing on today, allergies, and other chronic issues by addressing the underlying causes, such as nutritional deficiencies, an unhealthy gut flora, or inflammation. She's written a guidebook for parents, A to Z Children's Health, which is packed with practical advice on treating common childhood illnesses. Dr. Masson offers webinars and online courses on a wide range of health issues to support children and their families on their path to better health. So you can see she is very in line with the sort of work that we do here at Natural Super Kids. We have all of the links to find out more about what she does, to find out about her book, and we talk about that at the end of the podcast as well, but we'll have all those links in the show notes. So I will now introduce you to Dr. Leila Masson. Welcome to the Natural Super Kids podcast, Dr. Leila Masson.
Well, thank you so much for having me on your podcast.
Oh, I'm so happy to have you. I've been a fan of yours from afar for a while now. I've seen some, a lot of presentations that you've done at various kind of, workshops as a practitioner. So I'm super excited to pick your brains on all things PANS and PANDAS. So can we start with the basics for parents who might not know anything about these conditions? Can you tell us what is PANS?
Yes, so PANS stands for Pediatric Acute Neuropsychiatric Syndrome, which sounds really complicated, but what it is a infection-triggered inflammation of the brain. So a child has an infection, for example, strep throat, but it could be impetigo, could be COVID, could be any infection, and very suddenly their behavior and mood changes. And it is due to inflammation in their brain that actually travels through the bloodstream into the brain and makes the blood-brain barrier leaky and causes the cells in the brain, the microglia, so those are not the nerve cells, but the cells around the nerve cells to become inflamed. And what happens in a child is that a child who was perfectly happy and functioning well has this very, very sudden change, and parents can often tell you the date when exactly it happened. They may not remember the infection if it was a long time ago. If it was recent, and they usually do, but they can tell you on September 15th, my child woke up and was different. And there are some specific symptoms that are needed for the diagnosis. So the sudden change in mood and behavior, so often OCD and anxiety, separation anxiety. And then there are additional symptoms that are very typical for PANS, but not everybody has them. So tics, for example, that could be motor tics, like, crunching your nose or shrugging your shoulders or opening your eyes wide or, any of those tics, squeezing your eyes shut. Or the other one, very typical one, are urinary symptoms where the children suddenly start urinating very frequently and they keep going to the toilet thinking they have to pee again, but they don't. There's nothing coming out. So that's called pollakiuria. And just means, going very frequently, but nothing comes out. And a third very, very typical symptom is a change in handwriting. So children who were perfectly able to write clearly or draw pictures, suddenly everything just looks like scribbling. They can't do it anymore. And so if you have a combination of those symptoms, you really should think, what does my child have PANS? and get help, because it's very treatable.
Yes. And we've recently done a podcast on like bedwetting and enuresis. So like, weeing accidents. So just in terms of that change in urination, those things can be common with PANS as well, can't they?
Absolutely. So if a child was dry previously and then suddenly starts bedwetting again, along with OCD and anxiety, that's a very typical symptom. Or even daytime accidents, so that's an important clue. The other one that I haven't mentioned yet is a change in cognition. So if a child was a really good reader or great at math, and suddenly they can't do it anymore, along with the OCD and anxiety, and maybe rages or, other behavior issues, that's a big clue as well.
Yeah, and I think the key point is that sudden change, isn't it? That's really sort of the big red flag for PANS.
It is. It is. I have to say, though, that I have seen children who've been sick for a long time on and off. So with PANS, it waxes and wanes. So whenever you have another infection, you get another what we call flare with all of these symptoms. And then once the infection is gone, sometimes weeks or sometimes it takes months later, the child just gets out of it and is fine again. And in some children, maybe the beginning was so long ago that nobody can remember it, but they don't remember that sudden onset. They feel like it's been, the child has been like that forever, has weeks when they're perfectly fine, and then they have weeks where they're just a completely different person. And I even had a patient who had meningitis at like 2 months of age. And the mother said the baby changed at 2 months. But of course, you don't think of PANS with that because it's usually in older children. But when I met this boy, he was 10 and he had those waxing and waning flares of rages and aggression. And I mean, really difficult, along with tics and, those changes in cognition. And when he was treated for PANS, that all went away. So he probably had that onset at 2 months, which is quite unusual. So
Yes.
usually it's more school age.
School, yes. Yeah, but I mean, those symptoms are really hard to pick up in a young, like in an infant, aren't they?
Yeah, yeah.
Yeah. Okay.
And you get
Interesting.
used to it, right? If your child is like that, a lot of people would say, oh, my child is just difficult.
Yes.
And I feel that whenever a child's behavior is challenging, there's a reason for it. And you should, you know, play detective until you find the cause. And
Yeah.
hopefully you will find it.
Yeah, yeah, I totally agree. And I think this is a challenge with picking up PANS is that I guess life is busy and some families don't notice that kind of what we would say is generally a sudden change because also kids, I've got two teenagers, they can go through periods where they do change quite a lot. So I think another key is the combination of these symptoms, not just one off, because obviously those urinary symptoms that you were describing before could be a urinary tract infection, but if they've got those, some of those other things at play, that's when we want to start thinking about PANS.
Absolutely. And, you have to rule out other causes. Absolutely. For each one of those, it could be trauma. A child could be going through some traumatic event, have been abused, and you don't know about it and have exactly the same symptoms. So you definitely need to rule all the other things out. And there isn't a blood test or any laboratory test that absolutely proves that you have PANS, but there are things you can check, like a streptococcal serology, for example. So that's antibodies to strep in your blood. You can do a swab of the throat and nose and check for strep because streptococci are a very common cause for PANS. And you can do some other blood tests just to check for inflammation and things like that. But it's mainly to rule out other causes. As you say, a urine test to make sure the child doesn't have a UTI, and a blood test to make sure they don't have some raging infection at the moment.
Yeah.
Those are
Yeah.
important.
Such good points. And I think that's another reason why it goes so underdiagnosed is because there isn't a definitive test to say, yes, you have PANS. And then there's also PANDAS. So can you explain the difference between PANS and PANDAS?
Yeah, of course. So when this kind of illness was first discovered, it was associated with streptococcal infections. And the researcher who found that children who have rheumatic fever, which is an autoimmune illness after a strep infection, where the immune system attacks the heart valve in children. So that's rheumatic fever. There was strep infection and then inflammation and autoimmunity that destroys the heart valve. And some of these children had mental health issues. They had acute onset of anxiety and OCD and so on. So they found that there was a subset of these children who actually had inflammation in the brain caused by the streptococcal infection. And that was called PANDAS, Pediatric Acute Neurological Disease Associated with Streptococci. And then later on, it was found out that it's not just strep. It could be a virus, it could be another bacteria. So any kind of infection can cause it. And so it's called PANS. And now we also know it's not just infections. It could be a toxic exposure. I do have children who flare after they swim in chlorinated water. I mean, those are very, very sensitive children, but they get flared not by an infection, but by some kind of toxic exposure. That may not be toxic for everyone, but for that child it is. So now it's called PANS, which encompasses the PANDAS and everything else.
Yes, got it. And yeah, on the toxic exposure, there's a link with mold as well, isn't there?
Yes. So I see more and more families where it's not just one person in the family, but several who have, I think in mold, it often presents with rages. So very, very volatile children and anxiety. And often the parents also suffer, or at least one of the parents. So, and then, when you ask, they have had water damage and they have black mold, and that can be very, very toxic and highly inflammatory for the brain and needs to be removed, So if you live in black mold and you're sensitive to it, I always say mold is not good for anybody, but not everybody reacts terribly to it. So it's never a good idea to live in a moldy place. But, there are people who react violently to it, and they are the ones who need to get out as quickly as possible. And, I often say, why don't you just go camping for 5 days just to see whether there's a big change? And if there is, then the mold plays a big role. And then you really have to make it your priority to get out of there, which is difficult. It's difficult to find a mold-free rental in Sydney or Melbourne or even Western Australia or South Australia. I have patients everywhere. And they find it very, very hard if they're really sensitive to mold to find a place that's completely clean. So there's a lot you can do for that as well. But really the number one thing is to get out of the mold. And often the kids within days are changed.
Yes,
I also find that with mold, very often they don't sleep. They're up all night.
Yeah, okay.
So that's one of the clues that it may be mold.
Yeah. And it's just one of those easy things that you can do, like with mold or any sort of household toxic exposure, is to get out, and camping's probably the best, as you said, and just making sure your tent's not moldy either.
You get a new tent.
A new tent, exactly. Yes. So I love these tips. And we often, if within the practitioner team here at Natural Super Kids, if we are thinking, I wonder if there's some sort of household, toxic exposure going on, whether it's mold or something else, that's something that we will recommend as well. So I know you've talked about a lot of the signs and symptoms, but as we've also talked about, it can be, tricky to pick up and underdiagnose. So how do you know if your child has PANS?
So there are a couple of interesting findings on examination that you can check yourself on your child. One is when they go through the flares, they get really big pupils. Their eyes look kind of entirely black, the pupils. You see hardly any of the iris, the colorful part of the eye. And that's a clue. And then there's something called a Romberg test, where you let the child stand up with their arms stretched out in front of them like a zombie, with their fingers stretched out, and then they close their eyes. And you tell them you're just checking their balance. But what you're really looking for is whether their fingers start moving. And if their fingers start moving like piano playing, that's a pathognomonic sign of PANS, which means it's very, very specific for PANS. And then the next step is to see whether reducing inflammation makes a difference. So really the diagnostic test for PANS is to give ibuprofen or Nurofen 3 times daily for 3 days at the appropriate dose for the child's weight. So many children with PANS, by the third day of the ibuprofen, are back to their normal baseline, where they're happy and calm and the tics have gone or at least significantly reduced. That's your proof that inflammation is the cause of the issues, because you give ibuprofen for pain and for inflammation, but a child with PANS doesn't have pain, so you're not treating pain. And they're old enough to tell you if they had pain, if that was the cause, right? So all you're doing really is reduce inflammation. And if that is the case, then really the next step is to treat the PANS. And in the guidelines for PANS, the next step is antibiotics. And it often does make a huge difference. A short course, 6 to 10 days of an antibiotic. In Australia, we mainly use augmentin or penicillin for PANS. In America, azithromycin is more popular. We kind of reserve that for the kids who don't respond to augmentin or penicillin here, because it's broader spectrum. But, either one is fine. And the other kind of medical treatment for PANS is, if the ibuprofen didn't work, you can do a short course of steroids, a 5-day course of either prednisolone, Redipred, something like that, just once a day in the morning. And again, it's just to see whether, if you reduce inflammation, whether there is a significant change in the child's mood and behavior, and that takes. Now, some kids become angry on steroids. So if they're already really ragey, then I'm very reluctant to put anyone on steroids. And then there's, of course, lots and lots of things you can do to reduce inflammation in a more natural way. So, of course, we don't want kids on antibiotics long term, and we don't want them they can't stay on ibuprofen. I mean, some do, some very, very severe ones. And some stay on a prophylactic dose of antibiotics if that's the only thing that keeps them calm. But I always, add lots of other things that reduce inflammation. Specifically, there is a kind of an immune chemical called interleukin-17, IL-17, which increases in PANS. And there are lots, and ibuprofen reduces IL-17, so do steroids, but also omega-3, vitamin D, curcumin. There are lots of natural things that reduce IL-17 as well and help with that inflammation. So I always do kind of a comprehensive blood test to make sure the child has enough iron, B12, zinc, vitamin D. I check the inflammation markers and then, correct all of those things. I also check for some of the heavy metals like lead and mercury. So all the things we can check for free through Medicare, I include. And some kids have quite high mercury, which is also inflammatory and, of course, toxic for the brain. So if that happens, then they have to reduce their fish intake or replace large fish, where the mercury usually comes from, with tiny fish like sardines. And, if they have high lead, then obviously you have to look where that's coming from. Usually from old paint or antique furniture, but sometimes, toys from China that they're sucking on. So, but there's, lots and lots of things you can do to reduce that inflammation, help the child, especially avoid further flares. So I think if you just do the acute care of ibuprofen and antibiotics, and child gets over the flare and is fine, if they're vitamin D deficient or low on omega-3 or on zinc, they probably will get another flare pretty soon. So, and if you kind of get the immune system to its optimal state, also checking for allergies if they have allergy symptoms, of course, get rid of mold, then you reduce the risk of further flares.
Yes, I love that. I love that sort of, comprehensive, holistic approach, using the pharmaceutical medications, but also kind of digging deeper and making sure that I guess the root cause is being, addressed, and that chance of further flares being reduced as well. So yes, so much great information there. And I just love how simple that just idea of giving the ibuprofen for 3 days, 3 doses a day, to really sort of I guess, as a definitive factor as to whether PANS is a problem for kids. I think that's a really helpful tip for parents. Um, so can you talk a little bit about, PANS running in families? I know we've talked about maybe, if there's a mold issue, for example, at home, then potentially the whole house are going to be affected by that, the whole family. Are there any other sort of genetic factors or ways that PANS runs in families?
Yeah, very interestingly, typically there is a family history of autoimmune illness. So very, very often the mother has Hashimoto, an autoimmune disease of the thyroid, or someone in the family has rheumatoid arthritis, or a autoimmune or inflammatory bowel disease like Crohn's or ulcerative colitis. So those are very, very typical histories you get in the family. And it's always important to check the rest of the family. I also find that very often the siblings show similar tendencies, and sometimes one starts to have the PANS, and then once they recover, the younger sibling starts, or cousins. So there seems to be a genetic component, but we don't really know exactly what that is. So there's research going into that, and I assume it has to do with inflammation, IL-17, higher sensitivity to inflammation. The other thing that runs in families, and that's also really important to address in kids with PANS, is the gut flora. So everybody in a family kind of shares their gut flora. I'm sure your audience is super familiar with the microbiome and how it is very, very individual, and it's like a fingerprint. So you can identify someone by their gut flora. But there is an overlap within a family. So even though everybody has a very distinct gut flora, whoever lives in the same household shares certain aspects of the gut flora. So you can tell when you look at gut flora who lives together and who doesn't. And I mean, the gut flora is so important because the gut-brain axis is very well researched. And when you have an inflammatory gut flora, from eating a processed diet and not your, the recommended more Mediterranean style diet with lots of fresh vegetables, fresh fruit, nuts and seeds, legumes and whole grains, all the good things that feed the healthy gut bacteria in your gut. So if you have an inflammatory gut flora from eating a highly processed diet, then you will have more inflammation in your brain as well. So really important to address that. And a lot of kids with PANS will have tummy aches, diarrhea, constipation, which are all, by definition, an unhealthy gut flora. And it's important to check that out. But the other aspect is that if these children are taking antibiotics, you are also affecting their gut flora negatively. So very, very important to correct that, by giving the healthy diet, but also often probiotics, or maybe some herbal antimicrobials. If they develop thrush, for example, from the antibiotics, if they have an overgrowth of yeast, then, they start having the thick white coating on the tongue and an itchy bottom, and they wake up at 2 a.m. and can't go back to sleep, and they want to eat only sweets. That's all signs that they have thrush, and you need to treat that and maybe reduce the antibiotics. Yeah, so very, very important to keep the gut flora in mind with PANS. And there's actually a very interesting new treatment. So there are a couple of, I've talked about curcumin and, omega-3 and zinc and all of those already, but butyrate is being used a lot for PANS now. And butyrate is actually a short-chain fatty acid produced by beneficial gut bacteria, like lactobacilli. And if you don't have your gut bacteria producing that because they're not there, because they've been destroyed by antibiotics or because you didn't eat a great diet, then your butyrate may be low. And butyrate is the fuel for the gut cells. So the enterocytes, the cells that line the gut, live off butyrate. And if there's not enough butyrate produced by the bacteria, then those cells become unhealthy, and then you get a leaky gut. So butyrate is one of the treatments now used for PANS. And the other kind of new one on the block is CBD, which is, of course, legal in Australia. So we can prescribe it. And so with CBD oil for marijuana, I would always stay away from THC, which is the one that gives you the mind-altering effect. But CBD on its own has a very powerful anti-inflammatory effect. And in most cases without side effects. So, and can be, drop dose, that you can start with just a tiny, tiny dose. So I think that's also a very, very interesting new treatment that doesn't have a lot of side effects. So I'm always looking for treatments that are safe, accessible, and of course effective.
Yeah, and I think this gives, families hope that there are so many things that can be done. And I love that you brought up the gut microbiome because we often talk about the gut microbiome here on the podcast and, the damaging effects of antibiotics. But, these kids often need antibiotics, but then they've got that sort of altered or unhealthy gut microbiome. So that really does need nurturing and attention. Is there any specific probiotics you recommend for PANS, or is it dependent on the picture of the child?
So in general, I use probiotics that do not contain streptococci, because streptococci can, of course, if you have a very reactive immune system, it could even react to a streptococci that is not pathogenic. But so I would go for pure bifidobacterium and lactobacilli, ideally in a capsule, because if you swallow in a capsule, it opens up down in the colon where you want it. But if the children can't swallow capsules, then a powder is okay, but definitely not as effective. So, there are certain brands I like Spectrum Pharmaceuticals. Their Pro 450 is great, or their Probiosis, which has a Saccharomyces boulardii in it as well, which is really good for yeast. And it's very, it doesn't cause any extra acidosis. So that's important with probiotics. But there are lots of good probiotics out there. I think it's always start with a small dose. If a child has a terrible gut flora, they can actually have what's called a die-off reaction when you start even something as gentle as a probiotic, because you're killing off the bad bacteria or the yeast, and they can get a bit worse for the first few days. So in that case, I would start really low and maybe give a bit of a binder for a few days, an hour after the probiotics. So something like Toxaprevent or even just charcoal. If you're just going to give it for a few days, that would be okay. But you don't want to give charcoal long term because it binds nutrients as well. So, and Biome Daily Kids, I think, is also a nice one that comes as a sachet. I often do, so in kids who have really complicated PANS and complicated gut issues, I often do a microbiome test where I get an actual readout of exactly what they need. Some kids have already very high bifidobacteria, but no lactobacilli, then they need just lactobacilli and no more bifidobacteria. Or some have enough of both of those, but lack E. coli, or, there's lots of different possibilities. And if you have a microbiome analysis, you can be much more targeted in your treatment.
Yeah, much more specific to what that particular, child needs. Yes, I love that. And as you said, diet is really the foundation for a healthy gut microbiome. So, all the probiotics in the world won't kind of fix an unhealthy microbiome if if there isn't that, that healthy Mediterranean style sort of high plant food diet as well.
Yeah, and that's actually a really important thing to remember in PANS, is that kids, another one of their typical symptoms is food restrictions.
Oh, yes, we didn't talk about that, did we?
So they suddenly stop eating either because of the OCD, so fear of contamination, they think it's poisoned, or that's, not healthy. But very often kids will restrict their food intake. And then, of course, getting healthy food into them is even harder. And as you say, the only way to create a healthy gut flora in the long term is by eating the food that feeds a healthy gut flora. So that's a high fiber diet. And probiotics will make a difference short term, but they don't stay in the gut. All they do is they create a different environment, which then allows the healthy bacteria to start growing. But if you don't feed them with healthy food, they're going to be gone again. So I think the most important thing you can do for your children's health is to start them out on a healthy diet. You do 5 handfuls of vegetables a day, 2 handfuls of fruits, a handful of nuts and seeds, at least 1 handful of legumes, and some whole grains, so brown rice instead of white rice. And that is not even just PANS, that's for every child.
Everyone,
You know?
yes. Yeah, totally agree. And unfortunately, the state of kids' diets is rapidly going downhill with, the amount of processed food and packaged food and that sort of thing that they're eating.
5% of children in Australia get their 5 handfuls of vegetables.
Wow, 5%.
1 in 20. And I always think that's what we should actually do as a public health, is to send everybody a box of vegetables and fruit every week and make them eat it.
I mean, how much would that save on, medical costs for
and long-term heart disease and, diabetes, all of those things. Yeah, it really, to me, that's the most important thing you can do.
Yeah. Yes. Well, we definitely agree on that. And lastly, I wanted to ask you, what's the long-term outlook for these kids with PANS?
So most children will outgrow PANS. 99% will be completely fine by the time they're in their teenage years. So that's the good news. There are some children who have just 1 flare or 2 flares, and that's it. That's pretty rare. That's a minority. Most of them will have some flares, so be prepared for that. Don't stress out if they have it enough. Just be prepared and know exactly what to do. Give the ibuprofen. If they need antibiotics, give the antibiotics. Make sure they get their vitamin D in the winter, those kind of things. There are some children who are quite ill with PANS. I mean, the severe ones, I would say the top 5% or so, they're the ones who actually look like a psychotic. They often end up in hospital. They end up on really intense immune therapies like IVIG, intravenous immunoglobulin. But that's really just the very, very most severely affected children. Most kids don't need that. But even those kids, they recover. It does take time. And it's incredibly stressful for the family. I've seen so many children where the parents just were exhausted and they need help. They need help from their community. They need help from support workers, because it's a 24-hour-a-day job to take care of a child who's just highly, highly OCD, won't eat, just is super hyperactive, goes through these rituals of showering for hours or whatever they do. It's that each child has their own rituals and OCDs that they go through, but they do recover. That's the wonderful thing, they do. And that's, I think, a very, very important message to every family out there, because it's easy to give up hope when you have such a sick child.
And like you said, it is a lot to hold and to deal with for parents. So yeah, I just want to thank you for sharing, awareness on this topic, because we were sort of having a bit of a chat beforehand in terms of just, bringing more awareness to PANS, because a lot of people will go, it gets missed, and a lot of medical professionals just aren't aware of it. So anything that we can do to, increase that awareness, I think is a good thing. Can you tell our audience a little bit more about where they can find you and what you offer?
Yes. So, one of my most important goals in life is to make everybody aware of PANS, because I see so many children who had the symptoms for years and weren't picked up. They were not diagnosed, and there were some children were admitted to closed psychiatric wards, and you can imagine what kind of trauma that causes for an 8 or 10-year-old or even 12-year-old to be in a psychiatric ward when all they needed was an antibiotic. So So it affects about 1% of school-age children. So it's not rare. And whenever I give a talk about this, people come up to me afterwards and say, oh, my friend's daughter was exactly like that, or my nephew, now I can see what the cause was. So everybody knows someone who's somehow affected by that. So the I have a website called drleilamasson.com, and I have some webinars on there, including one on PANS, that it goes into a lot of detail about, how to diagnose it, what tests to do, and all that. I am also going to launch an online course on PANS, which will give you really practical things, steps on how to approach it. So, for example, here's the diagnostic checklist. I will check it off. Does my child actually fit the criteria? Yes, my child does. Here is the paperwork you take to your GP to show them that your child meets the criteria, and they've already done the ibuprofen trial and they're much better. This is the next step in treatment according to the guidelines. Please prescribe the antibiotic, because that's often the hurdle, to get a GP to prescribe the antibiotics, because they haven't heard of PANS.
Yeah, and they
And
see
it is a bit
OCD
controversial because there isn't a straightforward test. There is actually one test that proves that you have PANS. It's called the Cunningham profile. It's a test that's done in America, costs like $1,000. I never recommend it because I find that the ibuprofen is the test for me. But that test shows you the antibodies against parts of the brain, the receptors, like the dopamine receptors and things like that. So that proves that you have inflammation in the brain. But I don't think you need that test. And no doctor here in Australia would accept it anyway, because it's not an Australian test. But so I'm also on Facebook, and I have a ADHD course online now that's starting in a couple of weeks. Also very hands-on, where you learn all the things you can do to help your child thrive despite their ADHD. And I am, as we talked before, I'm finally getting on Instagram. So I will post interesting new research on there on children's health topics. So those are all the ways that you can get in touch with me.
Beautiful. And I will make sure that we link all of that in the show notes so people can find you really, really easily. Oh, it's been such a pleasure to talk to you today. Oh, yes. And you have a book as well. Do you want to tell us about your book?
Yes. I've written a book called Children's Health A to Z, a guide for parents, that goes through all the common health issues that children may encounter and how to treat them in the most natural and most effective way, and when to get professional help, kind of the red flags. And that is available as a Kindle book. It's almost sold out as a book now, but it's coming out as a new edition in a year with some added chapters on mental health. So all the common mental health issues, because that seems to be a bigger issue now than the physical health for children, especially since COVID. We have so many children who are anxious or sad or hyper or OCD that I wanted to give parents some practical tips on what they can do to help their children overcome those.
Yes, definitely. And so we'll link to ways that people can get your book in the show notes, and maybe we'll get you back on when your new edition is launched so you can, talk more about that, because that sounds like some wonderful additions that you're adding to your book.
Oh, I'd love that. Thank you.
Well, yeah, thank you so much. It's been such a pleasure to chat with you today.
Thank you, Jess. It was really fantastic.
Thank you so much for joining me on the podcast today. Head on over to our website, naturalsuperkids.com, for the show notes for this episode, as well as a whole heap of inspiration to help you raise healthy and happy kids. I'll see you next week. before you go, don't forget about my free online on-demand masterclass, 3 simple ways to naturally boost your kids' immunity to avoid a winter full of sickness. I'm sharing my practical tips on ways that you can strengthen your whole family's immune system to avoid the onslaught of winter infections so your family can stay healthy and well this winter. You can sign up at naturalsuperkids.com/immune.